My name is Kylie Christensen. I'm going to be doing the skill of the colostomy bag and replacing the stoma, or cleaning the stoma, replacing the bag. My supplies needed are my pre-cut and measured bag, plate on the stoma, gloves, skin barrier. These are my 2 washcloths. I don't have any right now. And my bag for trash. And then hand hygiene. After that, I would go up to the patient's room behind me, make sure the curtain's closed for patient privacy. I would perform hand hygiene, and then I would introduce myself to the patient. Hi, my name is Kylie. I'm going to be your nurse today. Can you tell me your name and date of birth? I would verify the patient's wristband. That's a correct patient. Thank you so much. I am here to change out your colostomy bag, clean it up, and replace it with a new one. Do you have any questions for me? Perfect. I'm going to go ahead and get set up. First thing I would then do would be to put my gloves on. Get my bag of trash set up. Alrighty, I'm going to go ahead and remove the top bag first. Please let me know if at any point you experience any pain or discomfort. So then I would start here and I would remove it around. I would then take the bag to the bathroom and dispose of it, inspecting the stool for any color, smell, mucus, or blood. If it's liquid, I would make sure to empty that into a cup to measure it. If it's hard stool, I would just make sure the smell, odor, everything looks okay, and make sure that I document anything that doesn't. I would then dispose of this into the trash. I only have one, and for sake of the skill, I'm going to reuse it. So this would be a fresh one, but I'm going to keep it over here for later in the skill. I would then come over to the patient and I would remove the plate gently from around. Peel slowly. Can you just keep it steady? And then I would also dispose of this, but I only have one, so I'm going to keep it here. Perfect. After removing the bag, or after removing the plate, I would then inspect the skin for any breakdown or discoloring. So the normal color should be a red, pinkish, moist look. If it is blue or dry or ashy, I would make sure to report that to the doctor immediately. That could be a sign of the tissue dying or something not being healthy with the stoma. After I inspect it and make sure everything looks okay, I would then moving on to cleaning it. So with my washcloth and whatever cleaning is prescribed by the doctor, I would clean around the stoma. So starting from one side of the other. If there's any stool or anything that gets on the rag, I would make sure to use a different one. And then I would go the other way and clean around this side. If I happen to bump it and it starts to bleed, I would let the patient know that's completely normal. After I clean it, I would dispose of this washcloth. Then I would measure the stoma to make sure that I have it measured to the right size. This is my pre-cut one that was measured to the stoma, and I only have one, so this is what I'm going to be using. When you're measuring it, you want to make sure the measurement is about 1/8 of an inch away from the size of the stoma, so that it's not going to be strangling the stoma, and it's also not going to be loose around it. You want it to be perfectly fitted around it. So I would make sure I have it measured and cut to that. After that, I would then dry it. I'm going to go ahead and dry it for you now. So dry around it. Throw away this washcloth. Then I would apply the skin barrier. I'm going to go ahead and apply the skin barrier. This is just going to keep it so that we don't get any rash or blisters. So I apply the skin barrier and set it to the side. Before I apply the new plate, I would make sure that it has fully dried so that we can get a good seal. I waited the appropriate amount of time for it to dry. So now I am going to go ahead and place the plate. I would remove this backing for a good seal. and take the plate, put it on it, and press down around all the edges. I would check around to make sure there's no tearing or coming away from the skin, keeping it there. Once that is there, I would then take the bag and apply the new bag. Alright, I'm going to go ahead and apply your new bag. When applying this, I want to make sure it's going to click into place around all of the edges. And then, for extra, you can either ask the patient for help or you can do it yourself. Just place your hands gently over it to apply some more to adhere the seal better. So I would keep my hands here for the appropriate amount of time. After that, I would make sure the bag is closed. Alright, the bag is closed. Alrighty, you are finished. I would make sure that the patient is comfortable and her collet is within reach, the bed is lowered back down. Are you comfortable? Great. I would cover the patient back up, take off my gloves, dispose of them, hand hygiene. On my way out, I would close the curtain for privacy, and I would leave and go document my results.